In this video, we would like to discuss some important points as related to working as a dental assistant at various University of Florida dental clinics. To be successful as a team member in the dental arena, not only does one have to have an understanding and skills in place to perform their duties, but they must also understand the place they are working and who are the people an assistant will come in contact. Obviously, an assistant will be working closely with either a senior dental student or with a faculty dentist. They will also be interacting with patients, both adult and child, with other staff members, be they assistants or hygienists, and also volunteers and pre-dental students who are in the clinics for observation. Each one of these people will contribute to the overall personnel environment, and the demands of interacting with these people will be varied and at times challenging. For your experience to be successful, we have presented several assistants and 2 dental students who will give you their perspectives to understanding the atmosphere you will find yourself and some tips on what you can do and also not do while being in the clinics. Everything shared is designed to help you have a measure of understanding as you spend time in what otherwise may be a foreign place. Listen now as we hear from several different people who each fulfill a different role in the dental clinic. This is Leslie and Shelby, and they are full-time dental assistants here at our dental clinic. And tell us, if you would recommend anything to anyone who's new to dentistry about what they should have in place, what they should do in order to be good dental assistants, what would you recommend?
I would say multitasking. Throughout the day, we have to do several tasks such as break down the rooms and set them back up, make sure patient flow is good, develop x-rays, make appointments, so everything just has to be right on point and you have to be able to multitask.
Very good.
As a student, you can come through the facility and notice that the schedule says certain things, but when the patient arrives, those things are up for discussion. What needs to be done, what should be done, and what will be done may not necessarily coincide, or they may. One thing may be more important than the other. So we are going to change what we have set up for, even if it is necessary for the patient and their well-being.
So being able to kind of work on the fly is important?
It's very important in a dental facility, in any facility for that matter.
And also, I think these folks that are going to be attending there at the University of Florida dental clinics are going to be working with different doctors.
Yes, every dentist is differently, and especially in our office, we have more than one dentist. And these dentists are polar opposites. They work differently. Every dentist does, and you'll pay some mind to that.
Hey, Q.
Hey.
Q is one of our full-time dental assistants here at the health department dental clinic. And tell us, Q, if you were going to recommend anything to a new person into dentistry to be a good dental assistant, what would you recommend?
I would recommend that whoever it is, if it's an assistant or just anyone in general, that they know the procedures. It's very good to know the procedures because you can anticipate the dentist's needs. Basically, it's like mind reading almost. You know what to pass, what's coming up next, and it keeps a good flow going throughout the day. I think that's very important.
One of the things that I'd like to do is to introduce you to 2 senior dental students from the University of Florida College of Dentistry. There's Keith and Joey, and they're in the class of 2014. All right. And they're going to be graduating, but also they have gotten the opportunity to work with dental assistants here at our rotation. And one of the things that I'd like to do is to have them get a chance to share some of their experiences about what it was to work with their dental assistant. So Joey, tell us.
Oh, it was amazing. You know, at school every once in a while we'll get some dental students, or excuse me, pre-dents coming through and get assistance from them. And the biggest, I guess, point of view from where I'm sitting is don't be scared to ask questions. You know, there's going to be things you don't know, equipment you don't know, procedures you don't know. I might not even know some of it. You know, I'm constantly asking my professors, my faculty questions. Please don't be scared to ask us, because it not only helps us by teaching you, it also helps us working together with you to get things done more efficiently and just, you know, make that patient happy. So
okay.
that would be my big thing. Just don't be scared to ask us questions of what things are or how to do something.
Okay, great. Well, thanks.
Yeah, you're welcome.
Yeah, and all I can say is just, come in with a positive attitude, and, the rotation here, we got to work with assistants. It just shows how much more efficient, dentistry can be in the clinic. You're basically just you and your patient all the time, so definitely don't be afraid to assist, ask a lot of questions, and, just try to get the most out of it.
Okay. Well, thank you very much. I appreciate it. Best of luck to both of you as you get ready to graduate.
Thank you very much.
In today's video, we would like to talk about the role of the dental assistant in a modern American dental practice. In many parts of the world, the dentists work alone. But in this country, in the United States, we find that the dental assistant has a very vital, a very active role working with the doctor. And it is not just to clean or to set up, but it is also to work alongside, provide services that they're qualified for. Many dental assistants today are trained in formal programs, usually ranging about 1 year. A lot of dental hygienists are in fact dental assistants also, and they fulfill a dual role in practice. The role that you will play as volunteers with the University of Florida College of Dentistry is to provide many of the services that a dental assistant would provide as they work with the doctor. The independent practice, that part of dentistry, or sterilization, or taking radiographs, all of those are services that a dental assistant will do. But what you'll be doing is working alongside of the doctor. And so what we're going to try to share with you are those things that are important for you to be able to help your doctors in that way. You've already heard from the dental assistants who work at the health department where I work, some of the things that they consider very, very important. Things such as flexibility, because very often what a patient presents with is not at all what we were planning on. A treatment plan that we make is based on something that happened in the past or a situation in the past, but in time things change, and so we have to be flexible. We have to be prepared to do something that maybe we didn't plan on as the patients come. Another is to multitask. It's very often that you'll have more than one thing going kind of at the same time. And those of you who are volunteering probably won't have too much of that, but a full-time dental assistant certainly will be doing many different kinds of things all at the same time. Another is the idea of knowing your procedures. I can't emphasize enough the value in you knowing what the procedures are, knowing the steps, step 1, step 2, all the way to the last step. Because what happens is, as you know the last, or you know all the steps that are involved, you'll be able to anticipate, you'll be able to predict, if you will, what the doctor's going to need next, and then you can get those instruments prepared, ready, holding them. You're waiting on the doctor. When the doctor is ready for an instrument, you'll already have it in your hand, ready to pass it over. What you'll find then is, from the doctor's point of view, speaking now as a dentist, if I have a dental assistant who knows what the procedure is and knows what I'm going to do step by step, what I find is that my work goes very, very smoothly, and it allows me to finish my work very quickly. And I work with children principally, and so children, they don't want to be in the chair very long, and if I can get in, do the work that I have to do, and help them along the way, they don't mind coming back. And so speed is important, but not at the expense of quality. But you'll find that the more that you're able to work with your doctor, you're going to find that your doctor is able to move along very quickly. And that's a good thing, particularly in a pediatric practice. The other thing is that if you know what the doctor's doing, the instrumentation, if you know the names of the instruments, and we have the videos for you to look at to understand what the instruments are by name and function. If you know the names of the instruments, then when they ask for a particular instrument, you won't have to look for it. You can go right to it. You've already set up the tray, and you know where everything is, and so you can go right to it and get it, pass it over to the dentist. We also have for you the videos on how to do four-handed dentistry, or how to do instrument transfers. And so if you haven't seen those videos, I encourage you to watch them. The dental assistant fulfills a multitude of roles. They work with the doctors, of course, and we've encouraged that quite a bit for you. But the other roles that they fulfill is that they interact with the parents, they interact with patients, They help the patients to understand what they're doing. They can kind of fill in the gaps, meaning if the doctor hasn't shared something, that the dental assistant then can go ahead and share it. Facilitating again, or helping the doctor to make sure that the patient is comfortable in the dental chair. The other thing that they do is very often they will schedule appointments for the doctors, or they will help the front desk people to understand what the procedures are that are going to be done. They certainly help the front desk in understanding what the procedures are from a billing point of view. The dental assistants just are incredibly valuable. To be honest, if I had to work all alone, I wouldn't have nearly so much fun as I do, as I have a good dental assistant working with me. Other things that the dental assistant is going to do is that in the way that they talk or they communicate. And so I have to kind of share with you that as you become more and more familiar with being around dentistry, you're going to start picking up the language, the lingo, if you will, of what dentistry is. And then at the same time, you're going to be talking with children. You'll be talking with adults who are not familiar at all with dentistry. And so one of the things that you're going to want to be able to do, and keep this in mind, is that the kind of language that you use when you talk to a peer or a colleague or a doctor is going to be kind of in dental talk, if you will. But on the other hand, when you talk with a parent or you talk with a child and you would try to explain things, you have to leave those words kind of behind because they don't understand that language. They don't understand the terminology. So now it's on you to try to figure out, okay, what words can I use? What things can I say that will communicate effectively for someone who is not knowledgeable of dental terminology? So a lot of times the doctor will explain something, then they're going to move to another operatory to see another patient, and you're going to be there with the patient, and the patient's going to say, what did he say? And then you're going to have to kind of translate, if you will. So if you can do that, that's a very valuable service to the patient to be able to communicate. The other thing is there are certain words that you kind of don't want to use while you're in dentistry. And again, from a pediatric point of view, this is crucial. And we call those buzzwords. And buzzwords are things like hurt and pain and shot and blood and things like this. These kinds of words are provoking to a patient. And so you always try to use words and listen to the people that you're volunteering with. But listen for words that will tell the truth, but without provoking them. So as an example, instead of telling a child that they're going to get a shot, we tell them that we're going to give them some sleepy juice. Now, they don't want a shot, they don't want the sleepy juice either, but at least one's not provoking them or causing them to be filled with anxiety. So be careful about the words that you use so that you won't be provoking or causing anxiety amongst your patients. So the other thing is that when you're working with your colleagues, with the other dental assistants, dental hygienists, and doctors, remember that the professional position that you hold in the office, that you are part of the team. And so, for instance, if you and some of your other volunteers don't have anything to do and you're in the hallway and you want to chat a little bit, well, that's okay, but remember that there's an operation going on. I mean, there's clinical functions going on, and so you want to be quiet and you want to use appropriate language as you converse with your colleagues. Another thing, from almost from a legal point of view, do not ever talk about a patient outside of the clinic in a way that anybody could ever figure out who that person is. Now, obviously, when you come to volunteer, you're going to see some really interesting things, and when you get back to your home, you're going to want to share, oh, I saw this or I saw that today. Be very mindful of how you tell the stories. There in no way should things be ever linked back to an individual person. And so my encouragement is to keep that kind of language to a minimum outside of the clinic. And it is a legal issue that you protect the patient, that you protect their identity, and you protect their position. Because when they come to visit with us, they have their full trust in us, and we have to honor that. So don't talk about the patients outside of the clinic, and that'll be good for you and good for everybody else as well. So as you work, you're going to interact with your colleagues in a professional way. You're going to interact with your doctor. Okay, remember the doctor will direct you. You'll work with your doctor as part of the team, but at the same time you're working for your doctor. So take your lead from the doctor. They're going to ask you to do things. If you're asked to do something and you really are not comfortable doing it, you don't know how, or maybe you only did it one time and you're just not comfortable, it's better to say so. To say, you know, maybe I could get another assistant to help me with that, or something along those lines. But do not be asked to do something that you're not comfortable or not proficient or competent to do, and then try to do it. Because if you make a mistake, the person that pays for that mistake very often is going to be the patient. And so only do what you're qualified to do, only do what you, in your own mind and by your own training, you feel that you can do. Otherwise, delegate it. With that, I think you'll be able to have a very successful time. Now, one thing, if I can share with you, those of you who are interested in going to dental school, becoming dentists, I applaud you for that decision. It's a great profession. The thing that I would say, as you share and as you learn and as you spend time in these various dental clinics that you'll work in, learn all that you can. Learn all the lingo you can. Learn all the procedures that you can. Learn the style of how dental therapy is being offered and the kind of relationships that the doctor has with his or her patients. These things are going to be very, very valuable to you, because when you get to dental school and then later on when you get to be a clinical practitioner, these things that you're learning as a volunteer become very valuable, particularly related to your role as a practicing or functional dental assistant. These are the things that you will learn and grasp hold of, so that years into the future, when you now have a dental assistant, you will be able to more effectively be able to train your dental assistant, because you yourself have served as one. And with that, I think you'll find your time is well spent, besides just accumulating volunteer hours. Now, we know that's important, but you can learn so much more if you will open your eyes to what's available for you out there in the clinical practice. So, for those of you that are pre-dents and interested in going to dental school, I wish you the best, and certainly all of the faculty, all the staff will be more than helpful to try to have you success as you work as a volunteer. Thank you.